If you don't know about the California Nurses Association, you are about to find out, and you're going to see why they are considered the strongest union in the nation. So the early to mid 1990s rolls around, and the California Nurses Association begins to intervene. They start collecting data, they start collecting reports from the nurses who work on these floors and are understaffed and caring for more patients than they can handle. They start collecting these nurses' stories. Nurses saying that they're taking care of 10 patients, 12 patients, 13 patients at a time. Studies that show that patient mortality increased with the number of patients a nurse is assigned to take care of. And the California Nurses Association begins to put two and two together. Staffing is not just a workplace issue. It's a public safety issue. Because while these hearings are going on and nurses are attending the hearings, so are the patients and their family. Families talk about how some of these patients are harmed as a result of nurses being unable to respond in times of crisis. And in 1999, a turning point occurs. This is when Assembly Bill 394 is introduced to the state legislature in California. The bill is called the Safe Staffing for Quality Care Act, but the bill didn't have any set ratios. What it was forcing the hospitals to do, and the state, was to set a minimum number of ratios. That's all they were asking for. And then the California Nurses Union and all of these nurses fighting for ratio laws flooded the Capitol building. They attended every single hearing. And at this time, hospitals launched a campaign against this law. They had lobbyists, they had economists talking about how this was going to be the end of nursing and the hospital system as they knew it. But nurses flipped the script. They talked about how this was about saving patients' lives, not about budget constraints. And in October of 1999, the bill was passed into law. And this was unheard of. The signing of this bill was something that nurses could have only dreamed about. But after the bill was passed, it was only going to get harder for these nurses to figure out how they could implement these policies. Because now the goal was to talk about the technicalities involved in implementing these ratios from unit to unit and specialty to specialty.